Hi, you're listening to the recording for Chapter 8, Overview of Genetics and Genomics in Nursing. And this is definitely going to be an overview. If you want to get into genetics, especially in nursing, it is a specialization and there is extra training. But we're just going to go over the basics for the purpose of this course. So as far as the nurse goes, the nurse does need to know about genetics. You do need to know about genomics as related to how you're going to do a health assessment and how you're going to support, identify support services. And there are definitely a lot of changes in genetic technology, and they're, looking at things like cloning different body parts, different organs. They're looking at changing hair color, eye color, making sure you have a boy or a girl. So there's a lot of different things that are going on in that realm. You have to know about it to the extent of where you're working. But as the nurse, you are the link between the patient and the healthcare services. You are the educator. They think that because you're a nurse, you're going to know everything. So definitely be aware of what you do and don't need to know based on where you're working. Okay. You do need to understand genetics and genomics as it relates to inheritance patterns and disease processes and how the body responds to certain things. Whenever you are looking at a health assessment, when you're trying to come up with nursing diagnoses, when you're planning, going through that whole process, you do need to be aware of genetics, genomics. You need to know any family history, and if there is a family history of a certain diagnosis, how is that going to affect the patient? Is it going to affect the patient at all? And they're looking at pharmacogenetics now, and that's just based on your genetic predisposition. How is your body going to respond to certain pharmacological treatments and therapies? Because they're noticing that there's some correlations and some links there. Okay. Genes, the genotype, that is your unique genetic makeup. The phenotype is the physical appearance, and it also includes biologic, physiologic, and molecular traits. But your phenotype is what is your hair color, what is your eye color. Chromosomes, humans have 46 pairs in every cell, except for reproductive cells. And they have 23 unpaired chromosomes, and when they come together, they make up the 46. Mutations are changes in the gene structure that permanently change the sequence of DNA. Mutations can be inherited, meaning they are present in the DNA of all the body cells and they're passed on in the reproductive cells from parent to child, or they can be germline, which means that they are passed on to all daughter cells when the body cells replicate in mitosis. They're more often referred to as hereditary. Spontaneous mutations happen at the time of conception, and then acquired mutations occur after conception. Non-disjunction is a condition of which the pair of chromosomes fails to separate completely, resulting in either 2 copies or no copies. So they'll either have 3 chromosomes because the 2 copies were made, or they'll have they'll have 1 chromosome because no copies were made. An example of the 3 chromosomes or making 2 copies would be trisomy or Down syndrome. And then Turner syndrome is whenever there are no copies made and there was only the 1 chromosome. Okay. Mendelian conditions are present on 1 or both chromosomes of a pair. They result from gene mutations and they're classified according to pattern of inheritance. They can be autosomal dominant, autosomal recessive, or X-linked. We're going to look more at that. So autosomal dominant can affect male-female family members equally. It follows more a vertical pattern of inheritance. It is carried on one chromosome of a pair. The offspring have a 50% chance of the mutation or of not getting the mutation and being unaffected or quote unquote normal. As far as the severity of the symptoms, it varies. So you might have severe symptoms, you might not have any symptoms at all, you might have mild symptoms. It just kind of depends. Penetrance is the percentage of the people known to have a particular gene mutation who actually show the trait. So you can have 100% penetrance, which means that you will show the trait. So if you have that particular mutation, you're definitely going to show the trait. Incomplete penetrance means you're going to have a certain percentage likely to show the trait. So you are not 100% guaranteed, but there's a percentage that you are likely to show it. So osteogenesis imperfecta is an example of incomplete penetrance. Okay. Familial cancers also are incomplete penetrance. There's a percentage chance that you are likely to show the trait, but that does not necessarily mean that you absolutely will. Okay. This is autosomal recessive. Pattern is more horizontal than it is vertical. Relatives of a single generation will tend to have the condition. Ethnic groups can be affected as well. If you have children of blood-related parents, you're more likely to have autosomal recessive gene mutations. You can be affected, you can be a carrier, or you can be unaffected. Okay. With autosomal recessive, 25% of the offspring have a chance of getting the condition. So let me see if I can use my nifty little pen here. Whoops. I guess not. I shouldn't have tried that. And X-linked, it can be recessive. It can also be dominant. Recessive is most common when it comes to X-linked gene mutations, and it's due to the mom being the carrier most of the time. The gene is located only on the X chromosome. It is an inherited recessive disorder seen in all males who have the gene because they have one X, one Y, and they get the X from their mom. Females with one affected gene are going to be carriers. They have 50% chance of passing the disorder to the sons and a 50% chance of the daughter being a carrier. There are other types of genetic conditions, multifactorial, which simply means that there are many different factors that come into play. Non-traditional inheritance, complex genetic conditions. Genetics is a very complex field, and they don't know everything about it. But you have birth defects, common health conditions that can result from interactions of the gene mutating, as well as influences from the environment that might cause gene mutation. Conditions can occur in clusters and families, but that does not necessarily mean that it is an inherited gene mutation. There is genetic testing and screening. The purpose or the goal of genetic screening is to identify diseases early on that, if left untreated, can be dangerous to the infant. It can be done perinatal, which means if you have a family that wants to conceive, they're trying to conceive, but they actually have not conceived yet, they can go and do genetic screening and genetic counseling. This can help to determine if they want to conceive. And then if they decide that they do anyway, it can help prepare them for the potential of them having a child that is affected. It can also be done prenatal to detect birth defects like neural tube defects and Down syndrome. And that's also to help prepare the family so that they know what's going to be coming. Genetic screening also can provide other reproductive options if they decide they don't want to take the chance. They might want to look into a surrogate or adoption. As far as what do you need to do in nursing, you collect information, you collect the medical history, family history. You identify those who need further genetic evaluation and counseling based on the medical history that you took. You can offer information and resources to them. You can collaborate with the specialists and participate in the management and coordination of care patients that do have genetic conditions. What you cannot do is give your own opinion or judge them based on what their decision is, even if it's not something that you would agree with. You cannot do that. And they might ask you for their opinion. They might say, well, if you were me, what would you do? It doesn't matter what you would do. You are not them. You do not give them your own opinion. You can get yourself into a very bad situation by doing that. So just always refer it back to them. It really doesn't matter what you would do. You're not them. You do not have their life. You're not living their life, and you don't have to deal with any of the consequences of the decisions. So they're the ones that really need to focus on what's best for them. What can they handle? What can they not handle? What are they ready for? What type of resources do they have? That sort of thing. As far as getting a family history, look at specific diseases that are inherited or genetic. Get a family, the first thing you want to do is get a history. So that's the first step. Get your history, assess for the risk, and then what type of testing strategies are there? You cannot order them. The physician can do that. So you can give them in general, here's the different types, but the physician will have to determine what the best type is. You can get blood testing done perinatal, prenatal. You can still get genetic testing to see if you're if the mom's a carrier or not, as well as the dad. But whenever it comes to testing to see if they are going to have a child with a genetic disorder, amniocentesis or other types of tests would have to be done, and that can come with complications. So that's something for the physician. You can identify family members that would be at an increased risk, but you cannot contact those family members and say, hey, I did genetic testing on your sister and she's a carrier for, I don't know, cystic fibrosis. So you might want to get tested. Can't do that. That breaks confidentiality and HIPAA. You can look at shared environmental risk factors because, again, that can affect or put someone at a greater risk for a genetic mutation. Okay. You can assess the risk for passing the condition on. So is it dominant? Is it recessive? Is it autosomal? Is it X-linked? And what does that mean? And you can definitely talk to the families about that. Make sure you have good patient communication. Make sure you have trust. Educate your patients. Be non-judgmental and be supportive. Okay. Provide pre-counseling information. Advocate for your patient. And provide support. Some patients will be concerned because if they get the genetic testing, then their insurance is going to know and it might change the insurance. They might say that you have a pre-existing condition because of the genetic testing that you did. They're not allowed to do that. That is actually against the law now. So you can calm them down about that. Okay. If you want to advocate for genetics, it's something that you just find intriguing and you want to learn more about, go for it. Get involved, learn about it, do everything that you can and want to do, and be an advocate for your patient, be an advocate for yourself. And when you're out there, You can have an educated opinion as long as you can support it. But whenever you're taking care of your patients, you have to keep your opinion to yourself because you're caring for your patient. It is not about you, it's about them. Okay. Find out what they know and what you know. Do not overstep boundaries. Again, make sure that you have culture in it. Past coping mechanisms and social support are super important, especially if they're having another child. If you have a 1 in 4 chance of having an affected child, that does not mean if you have one child that's affected, the other 3 won't be. You can still have all 4 children that are affected. It just means that with each child, there's a 25% chance that that child can be affected for autosomal recessive. It doesn't mean that only 1 of every 4 children will be affected. Completely, totally, 100% different. So if you have someone who has an autosomal recessive disorder and there's only a 25% chance that their child would be affected, they might have to have more children if they have one that's affected. They have their second child who's also affected, it can be very, very traumatic for them. So you need to make sure they really understand exactly what's going on. Again, it is about the patient. So respect their right to what they decide. Let them talk through the different options, help them through the options, make sure that what information they have is complete and is factual, and then let them make the best decision for themselves. Always maintain privacy, always maintain confidentiality, and never discriminate just because they don't necessarily see things the way that you see them. Okay.